This is for September 20th, 2012. We'll take the test initially, and we'll go over the animal drug testing in-class activity, which is a case study, and then finally the Chapter 4 organ systems terminology. This is going to be on ethics and social policy for pharmacy technicians. It's a case study regarding Plan B, or oral contraceptive pill. It was originally presented to pharmacy students by Lisa Chi, a pharmacy intern, and I modified it for my pharmacy technician students. The learning outcomes today are: I can describe the history of ethics in pharmacy practice, list current ethics-related issues, describe the selected case study. History of ethics in pharmacy started very early in the 1870s and was developed by the American Pharmaceutical Association. The American Pharmaceutical Association members consisted of practicing pharmacists, pharmaceutical students, student pharmacists, pharmacy technicians, and individuals interested in advancing the profession. Their mission was to educate its members and patients through the information, education, and support. Ethical codes are used to distinguish right and wrong in society. Over time, the codes are distorted, and new codes are adopted to clarify and to avoid uncertainty. First 7 were published in 1870 by the American Pharmaceutical Association. They were revised in 1952, 1969, 1975, and 1994. They included putting the health and safety of the patient first, patient confidentiality, promoting the good for every patient, respect and autonomy or independence and dignity for each patient. Current issues: autonomy versus interference. It's between a physician and patient relationship. It's a failure to disclose information regarding any adverse effects of medications. Confidentiality versus veracity. Pharmacy technicians are sometimes faced with an ethical dilemma within a household. For example, a parent calls and asks for the identity of several drugs found in the possession of a child to reveal whether or not the child is on birth controls. Non-malfeasance means do no harm. Can a pharmacy technician conscientiously object to dispensing a medication? Being able to say no to the morning after pill because of cultural or moral beliefs. We're going to do a selected case study on the morning after pill. Commonly known as the morning after pill, contains the hormone progestin that was originally approved in July of 1999. Each set contains 2 levonorgestrel pills, 0.75 milligrams in each pill, taken by mouth. It is a synthetic hormone that has been used in birth control pills for over 35 years. Potential to prevent up to 75% of unplanned pregnancies. It is considered emergency contraceptive that can prevent pregnancy when taken within 72 hours of sexual intercourse. It is not similar to an abortion pill, which contains high doses of mifepristone. Plan B acts primarily to stop ovulation. It prevents fertilization or the union of the sperm and an egg. If fertilization does occur, Plan B may prevent a fertilized egg from being implanted. If fertilized egg has already been implanted prior to taking Plan B, then Plan B does not work. In August of 2006, the FDA approved the sale of Plan B over the counter to patients 18 years and older. Under 18 required a written prescription from a doctor. In April of 2009, the FDA gave 30 days to make Plan B available to 17-year-olds. In July 2009, Drummond Pharmaceuticals received approval for the over-the-counter availability of Plan B one-step, 1 dose versus version of Plan B to women ages 17 and over. The case narrative: Mary is a pharmacy technician student on a rotation in a busy clinic downtown. Mary has worked with Dr. Jennings, her preceptor, for 2 weeks and gets on well with her. Alice, a patient, presents the clinic pharmacy to purchase a Plan B, an OTC emergency contraceptive, to Mary. Mary is a Catholic and believes emergency contraception is abortion and amounts to killing of an innocent human life. This has happened once before. Another technician was able to help the patient. Even though there are others in the pharmacy who could dispense the Plan B pill, Dr. Jennings decides it's time to teach Mary her duties and asks her to participate in the dispensing and consults for the drug. Mary is dumbstruck by this request. Is Dr. Jennings reasonable in forcing Mary to participate in filling this prescription as part of her education? Class discussion included Mary needs to decide if this is a profession that she can balance with her personal ethics. The duties and ethics of a pharmacy technician. Each individual patient is the center of the pharmacy technician's practice. Pharmacy technicians should be committed primarily to the welfare of individual patients. Pharmacy technicians should recognize the differing beliefs and values, and pharmacy technicians should respect each patient's right to self-determination. Do pharmacists and pharmacy technicians have an absolute duty to fill every safe and legally prescribed script? Students came up with reasons not to fill, including narcotics to be sold, and knowing that, interactions with other medications, early or too much prescribed, prescriptions incorrectly written, wrong person or person not allowed to pick up the medicine, and then insurance issues. Pharmacists working in the following states can legally refuse Plan B medications: Arkansas, Georgia, Mississippi, and South Dakota. Allowed to deny certain prescriptions, including emergency or other contraceptives. Pharmacists working in the following chains are legally allowed to refuse Plan B: Target, Walgreens, and Winn-Dixie. Also allowed to refuse to fill contraceptive prescriptions. If a pharmacist chooses to refuse dispensing a patient's prescription, he or she must refer the customer to a different drugstore. Do you think pharmacists should have the right to refuse to participate in these types of care? What defines participation? He came up with participation as an act or an instant of participating, to take part in or share with others. You are the only pharmacy in 100 miles. How would you handle this situation, since you cannot refer the prescription to someone else? The prescription needs to be filled. What should Mary do in this situation? Since the prescription needs to be filled either by Mary or someone else, Mary needs to clarify what is expected of her. Here are the works cited. Chapter 4, page 57 to 78, and workbook pages 30 to 33 for September 27th. The quiz will cover this material, and you need to continue working on your research paper.